Welcome to our third session of the day, everyone. I'm your host, Stephen McCollum, the Director of Programming here at Healthcare Innovation, and I thank all of you for joining us. Our next conversation is going to be focused on data. We all know that data is part of the engine and the operations of creating a great digital healthcare strategy. So we're happy to have it as a topic today. And here joining us today to address that topic is our editor-in-chief, Mark Hagland, who you met in our first session of the day. And we also have Cheryl Rodenfels, who is the Chief Technology Officer of Healthcare Americas for Nutanix. So welcome, Cheryl, and welcome, Mark. Before I turn it over to you, just a quick reminder to our attendees, you can ask questions two ways during the session. You can enter them in the Q&A box, or you can use the raise hand function, and I will unmute your microphone when we're ready to ask the questions during the Q&A portion. Again, put them in the Q&A box or use the raise hand function. So with that, Mark, I'm going to turn it over to you. Welcome, Cheryl. Thank you so much for being here today. Thank you, of course, to Nutanix for sponsoring the program, and I will disappear and see you guys during the Q&A process. Thanks again, and welcome, everyone.
Thank you so much, Stephen. Thank you to everyone in our audience for sticking with us this afternoon. And it's my pleasure and privilege to welcome Cheryl Rodenfels. Welcome, Cheryl.
Hey, Mark. Glad to be here.
It's always a pleasure to have you, and we keep having great conversations, and we're going to have another one. So how's that? So why don't you go ahead, just spend a few minutes talking about yourself and about your role, about your personal background and what your role is.
Sure. Before joining Nutanix, I was a healthcare CTO and healthcare CIO for a couple of large organizations here in the US. And I had a lot of transformation work. Early on it was getting things off of paper and putting them into EHRs. And then eventually everything was now upgrade to the next EHR, convert your ERP systems. Let's go with a combination of cloud and hosted solutions. So I've spent a lot of time modernizing organizations as well as being involved with mergers and acquisitions, which bring a whole lot of new challenges, and which we'll get into today about data and the amount of data we're seeing. But after the last merger and acquisition, I joined Nutanix because I had been a customer. And right now I'm helping a lot of healthcare organizations across the US build up their modern data center platforms, as well as try to solve problems with modern technology.
Wonderful. Well, we have a lot to talk about. So welcome. Tell me, let's do a level set to start out. We are in this amazing moment in time where hospitals and health systems, the people, leaders of hospitals and health systems, have more data than ever before, and they're swimming in it, but it's not well organized. Let's start at that 40,000 foot up view. How would you characterize that situation?
I would say it's relatively chaotic, and the challenge is, we can start with the pandemic because we're still there and we'll be there for a while. We've had such an increase in the amount of data that we've had to collect and track and actually report on data out to the federal government, out to now with the manufacturers of the COVID-19 vaccines. So you have all of this new data that people may have been collecting internally, but they had to turn it up. Now we're tracking ventilators. Those things weren't tracked, it pumps, other equipment. They're tracking more scheduling, even though they did some of it, because the amount of people they're bringing in to help combat all of the rise in hospitalizations, there's just tons more data coming in. But over time, what happens is you have a whole gallery, if you will, of applications from legacy things that you've had for 20 and 30 years, all the way up to things that you've installed over the last couple of years. I know at my last organization, we had 600 applications. That's for 12 hospitals, 300 clinics. That's a lot of data. And the challenge is most of those are in some sort of different format. So you have some from that are proprietary, from maybe they're from a lab system or from a clinical imaging system. You have the later EHR systems. You have old versions of word processors. So the challenge is they've come in over different times. You have different types of equipment. And bottom line is, you know you need it, but you're not quite sure what you're going to do with the data. So you just keep collecting it.
Yeah, exactly. So let's talk about how unorganized it is, and how does that non-organization impact healthcare IT leaders, clinician leaders, operation leaders, all the end users? What are kind of the domino effects or rolling downhill effects of the fact that it's not organized?
Well, part of it, and part of the challenge is, again, if you have all these separate systems, a lot of organizations have more than one clinical imaging system.
Yeah.
And, the vendors like the proprietariness because it makes them sticky. It makes it really harder for you to change away from them. But if you want to transition DICOM image to DICOM image to DICOM image, that's why we came up with vendor neutral archiving several years ago, because you needed to have something where you could play the image or view it, so that if you went to a different organization, or if it wasn't in the system of collection, that you could look at it. So those things happen and they continue to grow. That's just one example, but all the HR systems, all the purchasing systems, all of these come across and the data is different. Plus, each of the applications tends to have a database of choice. So you might have a SQL database, you might have Oracle database, you might have, with the EHRs, they have their own databases. Epic has Cache on the front end and on the back end, either SQL or Oracle. With all of these different types of database choices, and even some of the more newer ones, such as Mongo or anything else that is being created, you've got all of these separate things, and they match whatever application they were assigned to.
So let's talk about something that I know is close to your heart and mind: data retention and data discarding. I think this is an area that's really not well understood, even by some of the people who have to do it.
I agree. And I've, at the organizations I've been at, I had a really good data retention policy, at the last hospital, because we went through with our legal department and we went and found the state, the local, and the governing statute that said how long data should stay, because people tend to go with whatever the best rumor was. Oh, you got to keep that till somebody's 38 years old or whatever it is. And it's there's very few things that you actually have to keep for that long. So what happens is organizations start with a retention policy, and if they have a good one, a lot of times they don't follow it because there's a cultural thing, like every email that a senior vice president writes is golden, is going to be wonderful, or it's just that they aren't enforced. And then the other thing is, a lot of organizations don't have a strong retention policy. If you have those, you can set up business rules in a lot of your technical tools that will purge the data based on whatever rule it is. So for example, purchase orders, you don't need those really in most cases after 2 years, but usually after 4. Tax records, 7, but we keep them forever. HR records, you keep them forever, and you don't have to. So part of the challenge is not having a practice. You can't automate those things. And the second thing is, we hoard. We hate to throw anything away. So not only do we have it electronically, but we send a lot of stuff up to vendors like Iron Mountain because we couldn't possibly not do the paper copy from whenever we've had it. So now you've got a paper copy and you got the electronic copy. So we find ourselves hoarding data.
Is there also, oh, I apologize, is there also the possibility in some cases that what's happened is we haven't completely trained people? And training is such a terrible word because it's it's like like training people to work at McDonald's or drive a car. It's more like educating or evolving them in terms of understanding. That seems to be like an underlying issue in some cases, right?
It is, and I think that's part of it because if IT is saying, hey, this is, you're causing me to buy more storage every year because we don't have a policy, then it's a technical thing. It's writing a check exercise. Whereas if you don't have good governance over the data and you don't have somebody who's an actual data owner that can make those decisions, there's a lot of passing the ball saying, somebody needs to make that decision, but it's not me. So what a lot of organizations have done is they've established really good data governance, and every owner is assigned for understanding and owning how long their data is supposed to be there. Now, again, the easy way out is saying, we can't delete anything. But there really, if you start looking at the statutes, there's very few things that are forever data. The rest of it really is time boxed. So I think that's it. It's organizations that have established governance and that somebody is actually responsible for that data. They're really better at this. And I'll tell you, the other thing is when you talk to your legal department, the lawyers would rather have you have less data than more because everything is discoverable. So any action that comes in, emails, we all go through it where something happens. No organization is perfect, but you get sued and you have to dig that stuff up. If you had the data retention policy in place, you can't go back 10 years for email and you can't do all of this. And really the legal approach to this is let's just have it the right amount of data for the right amount of time.
Yeah. So it sounds to me, I'm going to try to parrot something back to you, and please tell me if I'm incorrect. It sounds to me as though best practices is kind of an umbrella concept that encompasses policy, governance, training and development and education, and obviously coordination with legal and whoever else you need to work with. All those put together, it sounds like make up best practices. Is that a good way of saying it?
Yes, absolutely. And I think, Mark, to add one more, and as we started to go on the education, it's understanding what's available, and really the culture of the organization is keep things for just long enough, and really, as you had mentioned, training the staff or making them aware of what is good data policy. I think the other challenge we have is with the increase in ransomware attacks and bad actors getting in to try to capture your data. The more that you have, the more they can get access to. And I've talked with a lot of customers recently that upgraded their EHR system a couple of years ago, but the old systems are still running because they haven't archived them. So there's a cost issue of you're still paying for the licensing because you have that system up and running live, even though nobody's accessing it. And then the second thing is with those systems live and still having access to them, you've just got more data that's at risk.
Yeah, exactly. So let's talk about, you and I have talked about the HIMSS Analytics Adoption Model for analytics maturity. Tell us a little bit about that and how it can help leaders and organizations to think through some of these processes.
Sure. One of the things is we all go through various types of maturity assessments, whether it's our security maturity assessment, our project management, maturity assessment, our security assessments. One of the things that HIMSS has been really good about, and there are other organizations that do this too, is they've developed a maturity assessment, if you will, for data. And what it really helps organizations do is it helps them baseline their maturity against what best practice is according to all of the organizations that participate, but it covers several things. It covers data governance, as we had talked about. Do you do this as do you do data and data governance as a true profession, or is it still a hobby? You know, it's very similar to what we've seen with security in the past, or what we saw with disaster recovery. But do you have policies and procedures? And what some of the best thing about the analytics model is it gives you an overview of what a best practice is. It doesn't tell you how to do it, but it gives you that in each of the areas of governance, data strategy, data integrity, to make sure that people aren't changing data, especially in closed systems. Retention policies. It talks about disaster recovery and high availability. So hospitals don't have to go to downtimes and put things on paper and then have to transition them back to electronic formats, right? So there are several components to this product, but especially for an organization that is looking to do things in a way that is more standard or standard across the healthcare industry, it's a great model to follow. And I would say that it does take a lot of work, and it takes some investment. It's not super expensive, but you have to have people that can actually build the model and document it. And then what HIMSS does is they actually come and they evaluate you against the model and against what you say you're going to do with each of the components.
Right. For anyone who's interested, it's HIMSS Analytics, HIMSS Analytics.org/AMAM. And what fascinates me is how even to get to stage 2, you have to have centralized database, analytics competency center. And related to the storage of data, do you see that in your experience that this is that this plays out fairly consistently, that the organizations that have developed good retention and discarding policies and good data governance policies also are the ones that are moving forward with analytics at the appropriate levels of development?
You're absolutely right. They are, because they're organized, and it's not a scramble for them to pull information every time they need it. And that's what happens, you know, when you're just doing reporting versus analytics. When somebody asks you for information, you run off to a reporting group and you have to create a report or a query or so forth. With a program, really anything that you do or any new information that you create, there's a process for it. There's a look to say, hey, do we have that thing already, or do we need to build a new one? And there's a series of checks and balances that says, where's the data coming from? What's the source? But because the data sources are identified, it's not a big scramble to hurry up and get a report out. It really is, you know, an straightforward request that fulfills a business purpose, and you can trace all of those things through your process.
What are the core pieces of advice that you would like to share based on both your own professional experience and then how you're advising organizations? And especially in the context of right now, as you mentioned, with COVID, organizations, patient care organizations are having to collect and report more and more data. And it does feel like they're drowning. So what are the kind of core organizing principles people might want to think about? And then obviously they have to develop a very individualized plan, individualized to their organization. But what are the biggest organizing principles they should be thinking about?
So I would say the first thing is it's not the technology or the tool. And that's why BI got such a bad name when everybody was into business intelligence. Everybody ran out and bought very expensive products. And then when they didn't do everything they were supposed to do, you're throwing your hands up going, well, we were supposed to have these great tools and they didn't do anything for us. Well, that's the wrong end to start with. You've got to have what are the driving things that your organization wants to report on or needs to know about. a lot of the community hospitals, their first goal is to meet their community health needs assessment. And you'll find that in every public hospital, city hospital, they have a CHNA. So whatever your goals are, your analytics need to support the goals. So it truly is a business driver, not necessarily driven by technology. It's supported by technology, but you have to say, what am I going to do? What do I have to report on? And when I get the results, is it really going to move the needle in how we care for our patient population?
Right.
So I think the first thing is, what does the business need as far as data requirements? Probably the second thing is, go take an inventory of what you already have. Chances are you have about 90% of what you need, but you've been collecting these tools and these processes and these things all the way along. And you probably have several leading tools and leading applications. I would say that would be the next thing, is take an inventory of those. The third thing is also take an inventory of your types of data and where you have it stored. Because if you have it in all of these locations, it's time to start talking about consolidating, and how do you get it down to the fewest amount of technical locations to store information in. And then I would think after that, figuring out what you want to do with the data. And so we have, various things of, hey, I've got to have an archiving strategy. Well, what is that? And what is your archiving? And where are you going to put it? And how much are you going to pay for it? So instead of having those EHRs that you never turned off, they should really be in some sort of archiving, as opposed to being in a live data, live environment, right? So I would say assess and make sure that your archiving strategy works. And then, of course, getting into having a strong data governance program. Bring in somebody who knows what they're doing. There are so many good data analytics professionals out there, enterprise data managers, enterprise data VPs. And these folks really know how to take that programmatic level and create a program out of it instead of a hobby, because a lot of us were still doing this as a hobby. And then I would say the last thing is, don't blame the tools. The tools are only smart as what you tell them to do. And a lot of times, because we didn't have that requirement that we asked for first, tools never going to fulfill it if you don't know what it's trying to achieve.
Wonderful. I love how you use the word hobby in this context. It's great. I keep thinking of a word related to everything you said about strategy, governance, management, and the word is agility. When you hear the word agility or the term data agility in this context, in the context of everything you just shared with us, what does it say to you?
You never know when your new requirements are going to pop up. So for example, I work very closely with a couple of hospitals. We're working on some analytics engines with them. And the thing was, they were pretty good at doing the basics already. So when they had new requirements, for them, the changes were incremental. They were able to add them really quickly. They didn't have to start from scratch to get the new reporting requirements in. So you need to be able to, whether, if we're going to get through COVID-19 and the next thing that comes in is murder hornets, and we're going to have to go through the murder hornet, pandemic, we need to be able to switch. The same thing is, with these vaccine companies that are providing the vaccines, it's one thing to have to change all of your data for one vaccine manufacturer, but now let's say that you have 4. You should be able to do those quickly. And that's one of the things that organizations are finding out is so chaotic. There's a different protocol for each. There's different storage. There's different training. There's different tracking. There's different whatever. If you're running things more programmatically and you're managing them, if you need to add something or if you need to take something away, it's not a 3-month spin up. It's hours to days. That's what agile behavior is. How can I get this out quickly to meet the changing needs?
Perfect. I mean, to me, everything that you've been sharing seems to really speak to the issue of ultimately agility, right? That you as an organization, you need to be able to collect, share, report on, use, store, discard, all those things, data. And you have to be able to do it in an agile way so that not everything takes 10,000 people and 100 years, right?
I agree. I think the other thing is, every time I would ask, my team would come and ask for more money for storage, I would ask, okay, so what happened to that $500,000 worth of storage we bought last year?
Yeah.
And everybody runs off to their corners and starts pulling out spreadsheets and saying, well, we use this for this. We weren't keeping up with it. We were not being good stewards of the environment, because that spreadsheet is only a point in time. If we ran dashboards and if we had, we have a lot of modern tools and every company has them. It's just making sure you use them. You should be able to pull that information immediately, and you should be able to predict your capacity and predict your needs.
Yes.
And I think that's what also plays into the agility is how can you predict what's going to happen so that it is a quick turnaround rather than, okay, let's take 6 months and the whole project and we need to get 23 teams involved in all of this. And for your business users, they feel like, IT is very heavy to them as opposed to being agile, as you had mentioned.
Right, exactly. Well, very well said. Thank you. So, Cheryl, what do the next 2 years look like for you, 2 or 3 years?
Oh my goodness. We're going to continue to see the data from the pandemic continue because the vaccines are just rolling out. So we'll be seeing this for the next year. I think as these mutations happen, we're going to keep seeing these, but the strong organizations are going to incorporate, they're really going to move from reporting organizations to analytics organizations, because if they have analytics and they have information that can help guide their business, it will help them make better decisions about what projects they should run and what services they should have. We've talked about the one customer that I work with that they took a look at their analytics, and what they saw were they threw in zip codes after they pulled their information on breast cancer. And when they pulled the zip codes, they saw that one zip code had just a larger population of breast cancer. And when they went back and looked at their plans, what they saw was they had no imaging centers in that zip code. So it really changed how they were going to spend their money. They said, okay, we need to acquire or build an imaging center in this zip code. In the meantime, that's a 2, 3, sometimes 5-year project, right? In the meantime, we can dispatch our mobile mammography van out there every week or 10 days, and we can start solving that problem right now if we get preventative care out there. That's what analytics are going to bring in. That's what organizations want to do, is they want to change the way that they're providing healthcare that really add value to the patients that they serve. That's what we're going to see analytics really driving for us. And again, that's not reporting. This is true decision influence.
Right. That's wonderful. I think that's a great note to leave this on. Is there any last thought you'd like to share before we conclude and Stephen magically reappears? Oh, he's already here.
Nope. I say, thank you. If you want more information, we're working with a lot of the big data providers and so forth, because everybody has this challenge. And this is solving from all the various sources that you have, and one size doesn't fit all. And we'd be glad to talk to you more about it.
Wonderful. Thank you so much for this wisdom, Cheryl. I learned a lot, and it's always really great to connect with you. And I know it was very helpful to our audience. So I'm going to turn it back to Stephen now, who has magically reappeared.
Yes. Thank you so much, Cheryl. It's always great to do a session with you. You have so much great knowledge. Just really appreciate it. And thank you to all of our attendees for participating. Coming up at 3 p.m. Eastern, we have our closing virtual session for today. That session is all about home remote monitoring trends or remote monitoring trends within healthcare, where hospital at home programs are going, et cetera. It's going to be a really great conversation. We have folks from Geisinger, we have folks from Brigham and Women's, we have folks from Intermountain. It's going to be a great, great discussion. So thank you all for attending. As a reminder, this will be available on demand in about 30 minutes via the same page that you access the live session from. Everybody have a great afternoon, and we'll see you at 3 p.m. And of course, thank you again to Nutanix for supporting the program. It's always great to work with you. Everyone have a great day.
Thank you.
Bye-bye.
Thanks.